Bakade Salah to our Muslim brothers and sisters out there in arrears. Your fasting and prayers during the Ramadan period will not go unanswered by the mercy of God for your individual families and for our nation, Nigeria. I welcome you once again to another exciting edition of your favorite program, El Tafe on AIT. On the program, we focus on critical health challenges, issues of women and children, with a view to finding lasting solutions. My name is Oshuomowa Daniels, your regular uncle. Worried by the upsurge in COVID-19 cases in Brazil, India, Turkey, and other Western countries, the federal government on Monday, 10th May 2021, took a decision to reawaken the consciousness of Nigerians who have thrown caution to the wind about the pandemic and preventive guidelines. The Lagos State government also rose up to the challenge with several mitigating strategies to prevent a third wave. This is the focus of the program today. Please stay tuned as we take you through our new segment before the main topic. The Nigerian Air Force has the primary responsibility of defending the Nigerian airspace by the use of air power and ensuring that other sister services enjoy favorable air situations in their respective areas of operation. Being in good health, no doubt, is of utmost importance to this assignment, especially at a time when Nigeria is faced with the challenge of insurgency and banditry. No wonder officers of the Nigerian Air Force started their 57th anniversary celebration with a medical outreach for members and people around their immediate community in Lagos State. The medical outreach covered a wide scope of healthcare services such as dental care, HIV testing and counseling, diabetes, eye care, and lots more.
Ensure that you use it the way you are directed to use it. I want to believe that with this, your mission will progress.
What they have done is to bring their values from where they are operating for our security in the areas of our air force, and bring down what they have in terms of health capacity to our people. So it's a good relationship, and of course it will our people are better for it, and of course for them too. It is also afford them to also have a closer look as to the health situation of our people.
Vaccine yẹn wọ́n bá wa wá láti ìlú òyìnbó wá sí Nàìjíríà wípé kí a gba vaccine títorí wípé kí ọ̀rọ̀ títí wa náà má dàbí.
Acknowledging that spiritual strength is vital to victory in any battle, they also had a Jumat and church service to mark the anniversary. To win the battle against insecurity, officers of the Air Force also solicited the support of the populace.
Whatever way we are trying to contribute to the nation building by fighting insurgency and banditry, we still need the support of the populace. It's very key to success in any endeavor that the military is trying to do. I assure Nigerians that under the leadership of the Chief of the Air Staff, Air Marshal Oladayo Amao, the NAF will continue to provide the needed power, that's air power, that is needed in support of whatever operations that we are undergoing all over the nation. And I'm sure in no short time, success will be achieved.
The anniversary had as its theme enhancing NAF air power capabilities for effective joint operations in response to contemporary national security challenges. Hypertension, commonly known as high blood pressure, is a condition in which the force of the blood against the artery walls gets too high. According to statistics by the World Health Organization, over 1 billion people globally are living with hypertension, a figure projected to rise to 1.5 billion by the year 2025. Out of these global figures, Nigeria accounts for about 1.5 million, and more worrisome is the fact that more than 50% of people living with the condition are unaware.
There's no family you go where you don't have 2 or 3 people suffering from hypertension. So we can declare an emergency on hypertension if we want in Nigeria.
And we're not aware of it, it creates a lot of problems.
Hypertension causes a lot of complications that can affect other vital organs of the body if left untreated.
Diet is central to hypertension. As scientists, we recommend that you should take salt less than 5 grams daily in your food. Too much fat in the food is also bad because that also can affect the arterial wall, the walls of the arteries. Try to exercise.
It's been found that a good number of people do not even measure their blood pressure. And when they do, some don't measure it accurately with recommended machines for recording the blood pressure. So you need to measure the blood pressure accurately. And then, of course, seek the services of a health care personnel that is trained, a doctor.
World Hypertension Day is celebrated 17th of May every year, as directed by the World Hypertension League.
Worried by the upsurge in COVID-19 cases in India, Turkey and other Western countries, the federal government on Monday took a decision to reawaken the consciousness of Nigerians who have thrown caution to the wind about the pandemic. AIT crew went out to feel the pulse of experts in Lagos State about the development.
And I wonder why the government is just waking up to starting that, because having been witnessing the terrible things going on in in India and some other parts of the world, it's even coming late.
There are still Indians that are flying into the country, and you are not doing what you ought to do. Now you want Nigerians to suffer because Indians are coming here to come and work. What we should do is to profile those that have visited India and don't allow them to the country. Or when they come in, you isolate them.
You remember even the British Prime Minister said that what has been most useful was the lockdown, not the vaccination. The vaccination did something, but the major effect of the bringing it down was through the lockdown. And why was that? Because it prevented the gathering of the people. It prevented people meeting in large places and that. That's what the lockdown did. So also, I think we've been very lucky in this country that this virus has not behaved that it was behaving in this, because we've broken every rule.
Some also expressed displeasure about the management of the pandemic so far, especially in the relation to the palliatives and CBN intervention fund.
During the lockdown, they said they will give people food. How many people? Were you giving anything? What are you saying?
With the 100 billion CBN loan that was promised healthcare system, you go and ask them what has happened to the money.
Despite the reintroduced COVID-19 restrictions banning large gatherings, many Muslims gathered for prayers to mark the Eid al-Fitr celebration across the Lagos metropolis. Eid al-Fitr commemorates the end of the 30 days Ramadan fasting, an occasion for special prayers, family visits, and giving of gifts.
Alhamdulillah Rabbil Alameen. Allahu Akbar. We need to pray for our country, we need to pray for our nation. We need to call on Allah to salvage our country and to heal us from COVID-19, because there are a lot of challenges in the land. And equally, we need to advise our people that we need to work together. And we need to advise the politicians too, that all these things that we are seeing borders about good governance. Unemployment, insecurity is about good governance.
I want everybody now to be everybody's keeper. Anybody that observes any unusual movement, gathering place, let us observe that. When we see something, say something.
According to health experts, about 18 Nigerians die of tuberculosis every hour. Nigeria has the highest burden of the disease in Africa and the third highest burden in the world after India and Indonesia. Over 75% of Nigerians with the disease are yet to be diagnosed or receive any form of treatment. In view of this, Stop TB Partnership, in collaboration with Treatment Action Group and some other health experts, have come together to seek solutions to eradicate tuberculosis in Nigeria.
The major challenge we have is that We still do not have enough gene experts because in the whole country we have only 403 gene experts, and some local governments don't even have. The government of Nigeria, the federal, states, and local governments to come in to support.
They say community tracing of drug-resistant tuberculosis patients is vital as it would help curb the spread.
That treatment is free, diagnostic is free. All you need to do is, when you have such a situation, if you cough for more than two weeks, go to the hospital. If you have a neighbor that has coughed for more than 2 weeks, you call our toll line 3340, which is established there.
One of the highlights of the workshop was the launch of the Drug-Resistant Storyboard, a document that details experiences of tuberculosis patients from diagnosis to treatment and cure.
My dear legations, I am Dr. Ibijoke Sawolu, the First Lady and TB champion of Lagos State. Do you know that 18 Nigerians every hour die of TB and that more Lagosians are at risk every day? Tuberculosis spreads from person to person through coughing and sneezing into the air. Your health is a great concern to me. If you have been coughing for more than 2 weeks, having chest pain, tiredness, loss of weight or night sweat, please visit the nearest health facility for testing and treatment. They are free. If you test positive, start and complete your treatment. Do not discriminate against tuberculosis patients. Let's support and encourage them to access free quality care. You can protect your family and community from the spread of tuberculosis. Go for the screening now and live a healthier life. Join the fight. End tuberculosis in Lagos. Ìgbéga ìpínlẹ̀ Èkó, àjùmọ̀ṣe gbogbo wa ni.
Judging by the daily figures of COVID-19 confirmed cases churned out by the Nigerian Center for Disease Control in the last few weeks, many were surprised why the federal government decided to reinforce the COVID-19 restrictions, especially the 12 midnight to 4 a.m. curfew. To find answers to the numerous questions and agitation by the people, we captured the Minister of Information, Lai Mohammed, on the issue.
Unfortunately, this thing has been reported out of context. What happened was that the Presidential Steering Committee on COVID-19 met, and we revised, we embarked on what we call the fourth phase of the ease of restriction. And what we did really is more to remind people of the extant regulations. Now, even when we eased the restrictions, the curfew between 12 a.m. and 4 a.m. is still on. But Nigerians are behaving as if COVID has gone and gone forever. And this is the mistake India made. India actually boasted they had conquered COVID-19. And then political campaigns started. Religious festivals started. And to compound matters for them, a new variant of COVID-19 appeared. And today, we have over 400,000 people, cases per day, and about 3,000 to 4,000 lives lost daily. And this is why in Nigeria, because every 3 months we review where we are and where we are going. And the only new things we have introduced was this travel restraint. If you are coming from Brazil, Turkey, or India as a Nigerian, you must go for compulsory quarantine. The other, there's nothing we have changed. We never opened nightclubs. We never opened gyms. The regulation on face mask in public places is still in place. Social distancing is still in place, but nobody obeys it. Unfortunately, nobody, but you see, Nigeria has been very fortunate because we have neither the health infrastructure to handle 3,000 cases a day. How many hospital beds do we have in Lagos State? But if it is the recklessness and the abandonment with which we treat COVID-19, people would have lost more lives than we have lost. So this is why the government said no. Please don't take this for granted.
We also captured the Lagos State government on the various strategies put in place to prevent a third wave of COVID-19 pandemic in the state and by extension, Nigeria.
That we have performed close to 470,000 tests, and of those tests, we've diagnosed about 58,000 Lagosians with COVID. The typical symptoms you can see on the screen, the characteristic symptoms of COVID are cough, fever, shortness of breath, body pains, and those are the main ones. Generally speaking, most Lagosians that contract COVID have a mild to moderate disease, and very few have severe to critical. Unfortunately, we have recorded about 354 deaths in Lagos out of a total of 58,000 positive cases. In effect, our testing continues to be constant. We are testing between 2,000 and 3,000 PCR tests a day. And we're continuing to maintain that so that we can get accurate information on what's happening in Lagos, in all the zones and all the local governments. And more on this as we proceed. Our oxygen consumption has decreased dramatically from a period where we were using 450 very large cylinders a day during the peak of the second wave. We're now down to about 60 cylinders per day. Now I'm going to turn attention to mitigating the third wave. Of course, if we look around the world, we can see that several countries are going through a second, third, or even fourth wave. And we are assuming that majority of these waves are caused by a significant social activity and movement of people, as well as the ability of the virus itself to change. So in Lagos, we have experienced the second and the first and the second wave, and we are looking at the factors that could possibly trigger a third wave. And in examining those factors, we have identified that laxity amongst the citizens of Lagos may cause the congregation of people and the creating the environment for super spreader events. We are also aware that there are several religious holidays which may also trigger congregation of people, so we are looking to advise citizens to respect the social distancing laws and guidelines to ensure that we do not create the opportunity for super spreader events. We also know that most people have got COVID fatigue, but looking across the world, this is not a time to relax. This is a time to step up our activity and ensure that we are preventing the scenarios that could trigger a third wave. Of course, the virus itself is mutating, and I'll speak a bit more about this. And in its ability to mutate, it appears to be gaining the capacity to become more infectious. In other words, it can move from one person to another more easily. Also examining the international data, it also appears that as it's mutating, it is gaining some strength to cause more sickness and illness in people that contract viruses that have mutated. This diagram shows you the potential of the virus to mutate. And those different colored viruses are suggesting to you that these are the mutants or the new strains that have emerged from the original COVID-19, which emerged out of Wuhan in China. In terms of being able to curb or to prevent the third wave, we are carrying out this strategy alongst 5 pillars. The first pillar is to make sure that we keep our testing high so that we can pick up early any evidence of a third wave emerging in the community. In addition to that, if we find positive cases, and that's in the first pillar there, if you are positive, we're going to repeat your test, this time with another type of PCR that can detect the possibility of mutations. So we are equipping the Lagos State Biobank with the capacity to do 2 types of PCR tests. The first type is just to pick up a positivity, and the second type is to try and help us characterize that virus and put it into either one of the strains that we know are circulating around the world, from South Africa to Brazil to Europe and to India. In addition, we're using eco-telemedicine and what we call the eco-telemed platform to manage people at home. But more importantly, as people are arriving from abroad, which is the most likely reason why we might get a third wave, which is because passengers are coming in from exotic countries and they may be bringing along with themselves the mutations and the strains of the new viruses. So it is important that when people are traveling into the country, that they follow the guidelines very strictly, which is, at the moment, 7-day mandatory isolation with tests that will determine whether you're free to come out of isolation or quarantine. The immediate need is the airport, where thousands of people come in on a daily basis. And it's most likely that we will see mutants and new strains coming in through the airport. That is the most important means of entering Lagos. We are fully aware of the land border and the seaports. So the land border on the border with Benin Republic, and of course the arrival of ships or cargo vessels by sea. So it's the same Port Health Authority that manages the airport, the land border, and the sea. So we're working very closely with the National Port Health Authority. We're putting the same protocols in place at all 3 border entries. But the emphasis is on the airport at the moment, because that's the most likely route that a passenger will be bringing in a mutant or a strain. Now, it's possible that to try and beat the protocol, people will go to neighboring countries and come in by road, or by sea. So we are wary of that. We are aware, and we're putting things in place to make sure that we understand where your port of destination, where you boarded your flight, your departure, and that we can track your travel history and apply the same sanctions to you, whether you're coming in through the airport, through the land border, or through sea. We will be using the eco-telemed to monitor people at home to make sure that you are complying with the 7-day isolation, mandatory isolation guidelines as stipulated by the federal government. Lagos State has just enacted a law. It's called the Lagos State Coronavirus Pandemic Law. It was enacted this year, and it gives Mr. Governor, the incident commander, the right to determine who is to be quarantined and for how long, and there are very stiff penalties for people who are going to be disobeying these laws. These laws are currently in operation, and the sanctions for breaking the law can range between imprisonment or hefty fines. And we are going to take this very seriously because it is important that Lagos State protects itself from any possibility of allowing a third wave to emanate within the boundaries of this state. Fourth pillar there is our oxygen strategy. We are ensuring that we have the capacity to make more and more oxygen in Lagos State. We have just installed 2 oxygen plants, and we're looking at a third and a fourth, just to make sure that should we go into a third wave, we will not be experiencing the scenes that we see on television in India, Brazil, and other countries. In addition to the 507,000 doses that we got from the federal government, we've also received in the last few days an additional consignment of 57,000 doses extra of AstraZeneca. Now, in view of the fact that we are receiving people in Lagos as travelers who are turning positive on day 7 test, we have decided to use some of these extra vaccines that we've received from the federal government in a strategy that we describe as the ring vaccination strategy. It is a well-known strategy for preventing the transmission of a virus into community. So in the center there, you can see an individual that has turned positive. And of course, that individual is isolating at home, typically. Now that makes the members of that household, no matter how careful you are, it makes you vulnerable to contracting the virus. So the ring vaccination strategy, when we get somebody that has turned positive, who has recently returned from abroad, and you have tested positive, then we will be deploying some of the vaccines to vaccinate members of their family, their immediate household, to stop the transmission of the virus from the traveler to family members or people that live in the same home or in the same immediate jurisdiction.
Mr. Governor, Mr. Baide Sanwo-Olu, on whose authority we have addressed you this afternoon, is saying that Lagosians, this is not the time to panic, this is not the time to be anxious, but it is time for us to keep to all the protocols of COVID-19 prevention that have been rolled out by the experts so that we don't have a third wave. It's time for us to be very careful, observe all the non-pharmaceutical protocols that we have been asked to observe.
Joining us, it's Health Affair on AIT. Now let's take you to our nutrition segment, an aspect of the show. What will bring you different fruits, food items, and their nutritional value?
Cocoyam, also known as Colocasia esculenta, is a plant belonging to the Araceae family and are grown primarily for their edible roots, although all parts of the plants are edible. Cocoyam are cultivated as food crops. They are generally composed of large spherical cones from which a few large leaves emerge. Cocoyam is undoubtedly an important food crop across many countries in Asia, the Pacific, and Sub-Saharan Africa, including Nigeria, Ghana, and Cameroon. It is the third important staple tuber crop after yam and cassava because it provides a cheaper substitute to yam, especially during periods of food scarcity. Cocoyam is most commonly grown for its edible roots and can be consumed after boiling, frying, or roasting. The flesh can be dried and used to make flour or sliced and fried to make chips. The leaves of the plant are also edible and are usually consumed as vegetable after cooking in dishes such as stew. They can also be baked and steamed. Because of the popularity of cocoyam in sub-Saharan Africa, It is estimated that West African countries alone consume not less than 4 million tons of cocoyam on an annual basis. This also indicates the production trends in terms of value and tons, as Nigeria leads other countries with a total annual output of 3.2 million tons in 2017. Cocoyam, popularly called Nigeria giant crab, because it has better nutritional qualities when compared with other roots and tuber crops such as cassava and yam. Has higher level of digestive starch, dietary minerals including iron, copper, magnesium, calcium, potassium, phosphorus, zinc, and vitamins such as vitamin A, vitamin C, thiamine, and higher level of proteins.
Our clinical segment provides you the opportunity to get vital health tips. Next is our perception segment.
This is not the time to get careless. We still need to practice all the same safe measures that we've been trying to do for the last year, which is we have to not gather in large groups. We have to stay masked. We have to sanitize our hands or wash our hands. We have to be careful. We cannot relax at this point. It's great that the vaccines are now starting to arrive. However, there's 200 million Nigerians. It's going to take a long time for everybody to get vaccinated, even in my own country. So we cannot relax now because we have a situation where variants are increasing, and so the risk is even greater.
This is the much we have for you this week. Please keep a date with us, same time next week, for another interesting edition of the program. My name is Ushuomowa Daniels. Please stay safe.